going to be a video on donning and doffing your PPE properly. Donning is the putting on of the equipment. You want to make sure you start with hand hygiene. Make sure that you get all the surfaces of your hands. Then we're going to start with the gown. Gowns come in all colors and made out of all materials. They are a protective wear for your clothing so that you do not contaminate yourself or take that contamination from one room to another room. You're going to get it on. Tie behind your head. Tie around your waist, covering as much of you as possible with the gown. And then we're going to move to our mask. This is a surgical mask. You want to make sure that it fits well over your nose, back behind your ears, and tucked under your chin. If you were going into a room for airborne precautions, you would use an N95. You have to be specially fitted for these so that you know what size to wear. Then you're going to go to eyewear. Protective eyewear is different than regular glasses. It will fit snugly to the face. It will come around to the side and protect, and have protection from anything coming down and in or side splashes. And last but not least, we'll be putting on our gloves. And that is the donning of our PPE. We're now appropriately gowned, gloved, masked, and eye protection on to go in and care for our patient and do whatever procedures need to be done. When we've completed that and we're ready to leave the room, we now need to duff our PPE. Just like putting it on, there's steps to which goes first and which goes to the steps to last. First is our gloves. These are going to be the most contaminated part of what we're wearing because we're touching everything. There's a special way to take these off. You're going to grab the glove, most likely with your dominant hand. You're touching this part here. Bring your fingers together, pull out, and the glove is now in this fist. This hand never touched the outside. You're going to slide a finger or two fingers under the wrist on this side, pulling it up, and creating a nice little package that's ready to go in the trash of your glove. The most contaminated part is on the inside that was in the patient room and touching the patient. The part that's on the outside is what was touching you. Now we can get rid of our eyewear. In my case, that means I can put mine back on and see again. And then we're going to do our gown. You're going to start at the neck, trying not to touch the outside of the gown. Untying the back. You're going to shimmy it down a little bit. You're going to put your hand on the inside of your gown and pull out. On the inside and out. Once again, making contact with yourself and not with the outside of the gown that has been mostly contaminated. Rolling it with it turned inside out so that you're making contact with the side that was touching you. Roll it up and it's ready to be disposed of. You can now take off your mask. Remember, hand hygiene when you're done. It's highly recommended to actually wash your hands, and especially it's mandatory to wash your hands if you've been dealing with a C. diff patient. If you've been dealing with a C. diff patient, you have to use soap and water to get all that off. Thank you very much and have a good day.